Good day. We are here to present our topic, Tracing the Population Growth Trend in the Philippines, presented by Group 2. Next.
Hi, my name is Joel M. Castro Jr. This is my presentation. What is the cause of population growth in the Philippines? Poverty is believed to be the leading cause of overpopulation, a lack of educational resources coupled with high death rate, leading to higher birth rate result in improve, impoverished areas seeing large booms in population. Next. The current population of the Philippines is 111,336,794 as of Thursday, September 16, 2021, based on Worldometer elaboration of the latest United Nations data. The Philippines 2020 population is estimated at 109,581,78 million people at mid-year according to UN data. Next. The Philippines population is equivalent to 1.41% of the total world population. The Philippines ranked number 13 in the list of
Daw, tagad lang daw ha.
countries and
Hapit ako.
definitions by population. The population density in the Philippines is 368 per km2, 952 people per meters 2. The total land area is 298 178 70 kilometer to 11 115 124 square meters miles. 47.5% of the population is urban. 52,603 people in 2020. The median age in the Philippines is 25.7 years. Ala, wait, a lot of families are misguided choosing the right pathway to live in the Philippines. Most probably, the main cause of overpopulation is poverty. First, people without education have problems getting ahead in life are the poorer health and are poorer than well-educated people. The main consequence of the lack of education include poor health, lack of participation, shorter life expectancy, unemployment, exploitation, and gender inequality. Next.
Philippines population. The population of the Philippines 1950 to 2020 chart plots the total population count as of July 1 of each year from 1950 to 2020. Philippines population 100 million, 80,000, 80 million, 60 million, 40 million, 20 million. Year population growth rate. The, the yearly population growth rate chart plots the annual percentage changes in population registered on July 1 of each year 1950 to 2020. This value can differ from the yearly percent change. Next, Philippine population live date 2017, 2018, 2019, 2020. Year growth rate percent 1.46, 2018 1.41, 2019 1.37, 2020 1.35. Year population
yearly percent trains, year, yearly trains, migrants, 2020, 100, ay 1,109,581,078. 1.35% in 2020. 2019, 100, 100, 108,000,000, 116,615. The yearly change 1.37%. 2018, 106,651,394. The yearly percent change 1.41%. 2017, 105,000,000 172,925. Yearly percent change 1.46%. Yearly change 1,464,463. The migrants is 6.6. Next,
Hello guys, my name is Danid Garvey Bagares, and what are four factors that affect population growth? What we might talk about as population size is actually population density, the number of individual per unit or unit volume. Population growth is based on four fundamental factors: birth, death, rate, immigration, migration and immigration. What is impact of overpopulation? Two, population is growing rapidly, far outpacing the ability of our planet to support it. Given the current practices, overpopulation is associated with negative environmental, economic, and outcome ranging from the impacts of overfarming, deforestation, and water population, and eutrophication, and global warming. So, ang impact sa overpopulation is ato ang ating ang ating ang ating mundo ay unti-unting nasisira. Tas marami na ring nagpuputol ng mga kahoy kasi sa dami ng mga tao wala na silang matirhan. Kaya doon na po doon na po ang effect ng overpopulation kaya nag-over farming sila, nag-deforestation at water population eutrophication and global warmings. Yan po ang impact ng overpopulation. Measure to control of population growth in Philippines. Effective population control measure are the need of the hour. We know that birth rate is mainly responsible for rapid population growth. Hence, measure which can reduce the birth rate should be adopted. This measure can be classified into three heads. Say next, guys. Kanino yan? Kay 9 ra ko taman, 6 to 9 ra may gikuan ni ma'am sa kuha. Kinsay 10.
Si Sheena ata.
Sinakuha.
Next. Next na ba di?
My name is Shinanoy Balahor. It's a minimum age of marriage. Fertility depends on the age of marriage. The minimum age of marriage should be strictly enforced. In India, minimum age of marriage is 21 years for men and 18 years for women have been fixed by law. This law should be firmly complemented and people should also be made aware of this through publicity. So, the minimum age of getting in marriage was 18 years old. Legal age of marriage for girls and boys, with or without a parental consent. Next, raising the status of women. There is still discrimination to the women. They are often confined to the house. Excuse. They are still confined to rearing and bearing of children. So women should be given opportunities to develop socially and economically. Free education should be given to them. In increasing women's and girls' educational attainment benefits both individuals and future generations. Next, spread of education. The spread of education changes the outlook of people. Educated men prefer to delay marriage and adopt small family norms. Education when, Educated women are health conscious and avoid frequent pregnancies, and thus help in lowering birth rate. Next, wala ko explain. Social Security. More people should be covered under Social Security schemes so that they do not depend upon others in the event of old age, sickness, unemployment, and etc. With these facilities, they will have lesser desire for more children. It provides a foundation of income on which workers can build to plan for their retirement. Next.
Good day, ma'am. I am Atwell Ian Dexter. So, late marriage, as far as possible, marriage should be solemnized at the age of 30 years. This will be reduce the period of reproduction among the females, bringing down the birth rate. So, para sa akin, dalawang pamilya na nagsama-samang bilang isang pamilya ngunit hindi sila legal o kinakasal. At meron din ibang tulad ng dalawang pamilya na nagsama-sama bilang isang pamayanan. At iba rin ay nasanayan dito sa Pilipinas kasi kapag hindi mo kinakasal ang iyong partner ay okay lang dito sa Pilipinas. Pero sa ibang bansa, if you do not marry and fathers do not live with or support the children. So, love marriage with parental approval as opposed to arranged marriage. At meron din tayong tinatawag na disadvantage of late marriage for the woman. So, first, you find it difficult to make adjustments and you are no longer as zealous as you were in youth, and you are start giving too much priority to finances, and you don't have enough time to spend together, and you have to rush for kids. Next, and family planning. This is method implies family by choice and not by chance. By applying preventive measures, people can regulate birth rate. This method is being used extensively. Success of this method depends on the ability to ship contraceptive devices for birth control. So, family planning allows people to attain their desired number of children, if any, and to determine the spacing of their pregnancies. It is a, achieved through use of contraceptive methods and treatment of infertility. At para sa akin ay isa itong part ng pamilya na dapat sinubaybayan kasi iba kasi nagmamadali at naapektuhan ang mga kabataan o ang kanilang mga anak. Dapat kasi hindi minamadali kasi tulad ngayon dapat mag-isip-isip ng mabuti kasi nga pandemic. Walang maayos na nga trabaho. That's all and thank you. Next. Next na.
So, good day, ma'am. I am Hamzari Pagador, and I'm gonna continue what Mr. Atwil discussed. So, number 3, publicity. The communication
Daw.
media like TV, radio, and newspaper are
Daw.
good means to
Tara,
propagate
bintana.
the
Mag-record ko.
benefits of the planned family to the
Bintana.
uneducated,
Sila ka ta.
illiterate
Mag-record ko.
people,
Oh.
especially in the rural and backward areas of the country. So, for advices ng example, yung family planning, kailangan yung i-public through media like TV, radio, para para rin dumating or ma-inform or ma-educate yung mga nakatira sa mga rural areas like bukid para rin matuto sila kung paano yung proper family planning. Example lang. Next, next. But number 4 is incentives. The government can give various types of incentives to the people to adopt birth control measures. So example is monetary incentives and other facilities like leave and promotion can be extended to working class which adopts small family norms. So yung government, minsan nag-offer sila ng example like rewards or promotion para para sa mga empleyado nila na to adopt ng birth control measures like leave or promotion. Parang binibigyan sila ng reward for doing that such things. Next, employment for women. Another method to check the population is to provide employment to women. As a result, their number in teaching, medical, banking, etc. will increase rapidly due to job pressure and promotion. They will delay having children. So, they have the idea rin na bigyan yung mga karamihan na kababaihan ng trabaho para mabisi rin sila sa buhay and to delay having and children. So kung busy yung mga babae, wala silang oras mag-raise ng child or mag-plan to raise a child kasi minsan kung maiisip rin nila na walang magbabantay, ganun. So, then, di nila pinaplano na magka-baby. So, yun lang. Thank you. Next.
So my name is Aline May Ranes. Main cities by population in the Philippines. There are many cities that rank highest to the lowest. Philippine population growth slows to 1.3%, but COVID-19 may turn things around. By David Santos of CNN Philippines, published on December 30, 2020 of 5:10 p.m. The Philippines is expected to record a slower population growth rate of 1.31% by the end of 2021. The government said, noting that Filipinos opting for smaller families may be causing the decline. But experts said that the impact of coronavirus pandemic may slightly alter demographic trends. The country's population is seen to hit 110 million and 881,756 by the end of 2021. The Commission on Population and Development, or POPCOM, said that is a projected 1.31% increase from 109,480,590 at the onset of 2020, slower than the 1.68% growth rate in 2016 and 1.45% rise between 2019 and 2020. This is because Filipinos are choosing to have smaller families and fewer children. Therefore, fertility is slowing declining, said PopCom Executive Director Dr. Juan Antonio Perez III in a virtual briefing. The country is still facing lingering issues related to climate change, migration, and teenage pregnancies. The long-term lockdowns and disrupted family planning services due to pandemic may lead to a rise in unplanned pregnancies and cause the population to swell at 111.1 million next year, citing data from University of the Philippine Population Institution and the United Nations Population Fund. Studies shows an intended pregnancies for women reproductive age 15 to 49 years old is at 2,560,000, a surge of 751,000 due to community quarantine induced family planning service reduction. However, we think since the GCQ or general community quarantine is not affecting the entire country, affecting around one-third of the country, we believe the impact will be a third of that. About 250,000 might be added to our birth rate. We also need to ensure that Filipinos' aspirations on having two children on average are attained amid service reduction in family planning due to pandemic. We also need to focus on the needs of the vulnerable part of the population as it also as often neglected sector. Among population groups, the most notable increase was observed in the working age cluster or Filipinos between 15 to 64 years old. Their ranks will increase by just over 1 million from 2020 and will reach 71,278,520 by next year. They make up to 64.15% of the entire populations. This implies the need for the country to create at least a half million new jobs next year, posing a huge challenge for the labor sector in the midst of pandemic. And that's all. Thank you. God bless. Again, we are the group 2 and we're presenting about the trends, tracing the trends of population growth in the Philippines.
God bless, ma'am.
God bless, ma'am. Thank you. Bye.
You